Well, hello, future EMTs. Good morning, good afternoon, good evening, depending on when you're listening to this. Um, this, as I promised you, I'm going to be going back over the first unit, the first six chapters, and we're going to post it on Moodle here so that you can have a review. More importantly, or as importantly, you're going to have a review, but you're also going to have, at the end of each of these, a multiple choice test. Um, if I can figure it the way I want to, it'll be hopefully instantaneously graded. As soon as you submit it, you should get your grade if I can get it configured that way. And I won't put any limit on the number of times that you take it. Um, I was a bit distressed to know that you had not taken that many multiple choice tests, and the reason is because um, multiple choice tests are the preferred medium for so many different forms of testing, particularly EMS. You're going to be taking multiple choice tests for the rest of your career. And I personally like to give a lot of multiple choice tests, particularly to EMT students, because a lot of this material is not familiar to them and they need it as a confidence builder for one thing, and as evaluation tool to know where they stand, to know what they need to study, but also because there is a certain amount of gamesmanship, for lack of a better word, to taking multiple choice tests. And before I go any further, I should say that there's no trick that I can give you that will get you around studying the material. That's the number one thing. Nothing I'm about to tell you in the next few minutes is going to help you if you haven't read the material, if you hadn't studied the material. But even if you have done that, a test maker can make multiple choice tests difficult. And the difficulty is often in the subtlety and the wording. Keep in mind that, there's oftentimes there is more than one right answer in front of you in a multiple choice test question, but you're looking for the most correct answer. I grew to hate that term in the course of my career, but I also accepted that was the way it was going to be. There are some things I can help you with, some tips I can give you for taking multiple choice tests, and I thought it might be profitable if I went ahead and got that out of the way even before I started going through the units, the chapters of those first six chapters. So, without further ado, let's look at a couple of things that might help you. In every multiple choice question, or in most multiple choice questions, there's at least one choice that is a throwaway. It's obviously wrong. It narrows your field. If you got four possible answers and one of them's wrong, well, you've just increased your chances uh, by 25% by eliminating one. That's not always the case. An extremely sadistic maker of multiple choice tests can have four pretty good answers up there and make it very difficult. But quite often there's a throwaway. Read the questions carefully, but don't overthink them. I can't tell you guys how many tests I have graded over the years where question after question after question, the student had the right answer, erased it, and put down another one. And it was nothing more than they overthought. My situation personally, usually if I've read the question carefully, my first impulse, that this my first instinct, that what is right is right. If you get stuck, don't just sit there and stare at it. It's going to make it worse. I would recommend going on and coming back to the question. Um, you can talk yourself, and I've seen it happen many, many times. You can talk yourself out of a right answer. Don't read things into the questions. What you see is what you get. What's there is what's there. Avoid distractors. And a distractor is exactly what the name implies. It is a piece or pieces of extraneous information that are designed to pull your attention away from the right answer. And I'm going to pull something right off the top of my head to give you an example. The question is, your patient has an oral temperature of 98.2. a blood pressure of 70/30 is jaundice and has a heart rate of 74. Which of those is the most significant finding? Well, in that question, the temperature's slightly low. It's not normal, but it's also not dangerously low. And the patient's jaundice, and I'm sure there's a fascinating backstory as to why. But given the information available, those two pieces of information are distractors. They're trying to pull me away. They're trying to make me think about what's causing the jaundice or make me wonder, why is this temperature a little bit low? When the answer is, of course, the patient's hypotensive, blood pressure is the problem. It's the most significant given the information we have at the time. Don't get sucked in by distractors. And some questions are very long and wordy, and they will throw out a whole lot of information that has nothing to do with the question they're asking. So make sure you know what the question is asking. Don't get caught up by the distractors. This one I can't overemphasize. Be suspicious of absolutes, especially in medicine. In medicine, guys, we don't like words like always and words like never, because that means something is absolute. It's always going to happen, or this is never going to happen. There's no such thing as two identical patients. You can have two patients, same basic medical history, same age, same illness, and have two completely different outcomes. We like to leave ourselves some wiggle room, so we don't use qualifiers we don't use words that deal in absolutes. In math, 1 plus 1 will always equal 2. In medicine, 1 plus 1 will in most cases equal 2, or often equals 2, or all things being equal will equal 2. But it's not, we don't like to nail ourselves down with absolutes. So watch for always, watch for never. Those are something to be suspicious of. And finally, look for qualifying terminology. And I'm going to give you an example. This is actually one of your test questions. It's on, I can't remember which one it is, but it's worded something like this. Which of the following has extensive training in advanced life support? And your four possible answers are MR, EMT, advanced EMT, and paramedic. Now, probably half of you will go, well, that's an easy one. The other half of you are going to say, but wait a minute, all of them have training in advanced life support. The qualifying terminology is the word extensive. This comes directly from your text, it's in your textbook, and the answer is the paramedic. Yes, I understand. EMTs do, anytime you assist with medications, or even in some cases administer medications, you're getting into advanced life support. Advanced intermediates do more of that than EMTs do, and of course paramedics do a lot of it. But right out of the text, right out of your textbook, it says extensive training. So look for that qualifying terminology, and it may help you narrow down the most right answer that you're looking for. The more you take these tests, these types of tests, the better at them you will get. You'll never get so good at them that you don't need to study, but you will get to a point where you avoid the pitfalls that some of these tips are designed to steer you away from. And like I say, in these remediation Moodle lecture series that I'm going to do, you'll have a chance to take a test at the end of each one of them. There'll be 6 of them. I hope this helps, gang. We're going to move on here in just a little bit to EMS systems.